Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is the best time of day to take Trelegy? You can take Trelegy Ellipta, generic name, fluticasone furoate, umeclidinium, vilanterol, in the morning, afternoon or the evening, but take it at the same time each day. Do not take more than one inhalation per day in a 24-hour period. Using Trelegy once per day will help to keep you free of breathing symptoms for 24 hours at a time. Trelegy ElliptaYou is approved for both the once-daily maintenance treatment of adults with chronic obstructive pulmonary disease, COPD, or asthma. Trelegy is not used for the relief of acute bronchospasm. You should use a short-acting bronchodilator inhaler such as albuterol, for example, Proventil HFA, ProAir HFA, Ventolin HFA, for sudden, acute breathing troubles. Always follow your doctor's specific directions on how to best use Trelegy Ellipta. You should take your Trelegy ElliptaYou every day as prescribed, even if you feel well. It is a maintenance medication used to control your symptoms. It will be most effective if you take it each day. Do not skip doses. Read and follow all patient instructions provided with the inhaler device. Ask your doctor or pharmacist if you do not understand these instructions. What if I miss my dose of Trelegy? If you miss a dose of Trelegy, take it as soon as you remember. Take your next dose at your usual time. Do not take 2 doses at one time. If you take too much Trelegy Ellipta, call your doctor immediately or go to the nearest hospital emergency room right away if you have any unusual symptoms, such as worsening shortness of breath, chest pain, increased heart rate, shakiness. Can I use Trelegy for an asthma attack? No, Trelegy is not a rescue medicine for bronchospasm attacks. Use only your fast-acting inhalation medicine, for example, albuterol, for an attack. If you do not have a fast-acting inhaler, call your doctor for a prescription. Seek emergency medical treatment or call 911 if your breathing problems get worse quickly. Trelegy is approved for use in both chronic obstructive pulmonary disease, COPD, and asthma. Learn more. Is Trelegy used for asthma? What is Trelegy used for? Trelegy Ellipta, generic name, fluticasone furoate, umeclidinium, vilanterol, is an inhaler that contains 3 medicines for the treatment of patients with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and emphysema, and for the maintenance treatment of asthma. Trelegy combines 3 medicines in one inhaler. Fluticasone, a corticosteroid that lowers inflammation, swelling, in your airways. Vilanterol, a long-acting beta agonist, LABA, that relaxes your airway muscles. Umeclidinium, an anticholinergic drug that enlarges the airways to make breathing easier. In September 2017, the FDA first approved GlaxoSmithKlines Trelegy Ellipta for the long-term maintenance of chronic obstructive pulmonary disease, COPD. In April 2018, the indications were expanded to include the daily maintenance treatment of airflow obstruction in patients with COPD. In September 2020, Trelegy Ellipta gained its 3rd indication for the maintenance treatment of asthma in adults. Trelegy ElliptaYou is approved in 2 strengths for asthma, fluticasone furoate, umeclidinium, vilanterol 162. 5/25 of a microgram and fluticasone furoate, umeclidinium, vilanterol 262. 5/25 of a microgram, both given once daily. Your healthcare provider prescribed the strength that is best for you. For COPD, only the lower dose, fluticasone furoate, umeclidinium, vilanterol 162. 5/25 of a microgram dose is used for treatment. Bottom line. You can take Trelegy ElliptaYou in the morning, afternoon or the evening, just be sure to take it at the same time each day. Do not take more than 1 inhalation per day in a 24-hour period. If you miss your dose of Trelegy, take it as soon as you remember. Then, take your next dose at your usual time. Do not take 2 doses at one time. Always follow your doctor's specific directions on how to use Trelegy Ellipta. This is not all the information you need to know about Trelegy Ellipta, generic name, fluticasone furoate, umeclidinium, vilanterol, for safe and effective use. Review the full Trelegy Ellipta product information here, and discuss this information with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.